Hello and welcome to our Facebook Live. I'm Sarah Carnes and I'm here at Trillium Creek Dermatology today. I'm with Michelle Taloni and I'm so glad to be talking with you today. How do we look and feel our best? There's so many opportunities out there, especially with cosmetic procedures that are available at Trillium Creek Dermatology. And that's what we're talking about today. And the good news is, since we're here on Facebook Live, you can ask your questions. So I'm going to be looking out for your questions. Go ahead and just type them into comments and we'll get to them. So Michelle, I'm going to start things off because I have some questions myself about this. First of all, let's start off and let's tell our audience, what cosmetic procedures do you have here that are maybe the most popular?
I would say our most popular treatments, I mean, we do a lot here, but our most popular ones are probably hair laser, chemical peels, BOTOX. We do a TRUSCULPting procedure, which is a nice body contouring procedure. So I would say those are probably our most common.
Okay, so let me just talk about those a little bit, because sometimes people hear a chemical peel and maybe some of those other things. I'm like, I hear about those, but I don't really know what they are or what they would be good for. Would that be beneficial to me? So maybe just a chemical peel, for example.
So a chemical peel is good for people who are looking to improve like pigmentation issues, fine lines and wrinkles, maybe a little bit of minor acne scarring, things like that. And it's pretty suitable for just about any skin type. We have a lot of mild peels here, so even people with sensitive skin can have a chemical peel.
Yeah, and you mentioned something with the hair. What was that again?
Hair laser.
Okay, so what would that be for?
So that is for people who have hair in areas that they would like to get rid of the hair. We do underarms. That's a very common area. Bikini line, so you don't have to shave as much, which is nice.
Yeah, no, absolutely. And then I think you mentioned CoolSculpting?
TRUSCULPting.
TRUSCULPting. Yeah. So tell us about that.
TRUSCULPting. That is a body contouring procedure that helps to dissolve fat cells in an area that we have trouble getting rid of the fat. So like the abdomen is a common area, or the love handles, things like that. Helps to shape.
Yeah, no, I've heard wonderful things about this. Like, who would be a good candidate for something like that?
Pretty much anybody can do the TRUSCULPting. You do have to have, at least some excess fat in the area to treat. But pretty much anybody can do that.
Oh, wonderful.
Unless you're pregnant.
Yeah, no. And I know a lot of women, I have a lot of friends who do this, who have questions about it as well. But BOTOX, it's so popular right now.
Yeah.
I know it's popular here as well. Tell us about where you can get it, what it involves.
So BOTOX is very, very common. It's something we do a lot here. You can do BOTOX pretty much, almost anywhere in the face. Definitely for the forehead, the scowl lines, crow's feet. We've done BOTOX in the neck, BOTOX in the, masseter muscles. So for people who clench a lot and have that, kind of square jawline, you can put it there to help slim the jawline too.
So how often do you have to, like, if you do BOTOX, how often do you come back? Is there, maintenance with it?
So BOTOX isn't permanent. It is going to wear off. It takes about 3 to 4 months to wear off. So I would say most patients are coming back about that time frame, 3 to 4 months.
Yeah. Oh, that's longer than I thought, maybe. Yeah. We do have some questions. I'm going to go with Amanda here. She says, is laser hair removal permanent? How many sessions do you need to see a reduction in hair growth?
So typically for just about anybody, we give a ballpark of 6 to 10 treatments. It's not entirely permanent. I would call it semi-permanent because typically people do have to come back for maintenance treatments after, a few years.
Okay.
So yeah, I would call it semi-permanent.
That's a lot more permanent than having to do it every day.
Exactly.
All right. Olivia has the next question. How does TRUSCULPT work? Do the fat cells come back? That's a good question.
So TRUSCULPT, that is a permanent treatment. Once the TRUSCULPT, it uses radio frequency and heat, damages those fat cells, your body's lymphatic system flushes them away, and that is a permanent treatment.
Oh, that's wonderful. Yeah. Megan would like to know, how often should someone get a chemical peel?
So most of the time we recommend a series of 4 chemical peels. You do them once a month for 4 months. And then I have people who will come back every year and do a series like that. So it really just depends on the person and what we're trying to target with the chemical peel.
Now, just out of curiosity, I have a lot of women who complain about like enlarged pores as they get older. Is that something a chemical peel would help, or is there something else?
That can help with, a chemical peel can help with the pore size too.
Okay.
It helps them appear, smaller and tighter.
Yeah.
So
good.
That can help.
Candy would like to know. It is one that I couldn't quite pronounce, so we'll get back to that one as well. You said that you have some of the most common treatments in the beginning there. Are there any that we didn't mention here that, people come in and like to do as well?
I would say one of the things that we do a lot of here that many people aren't aware of is an IPL treatment, which that stands for intense pulse light. And
Oh,
we use that to treat brown spots. So people who have like the darker brown spots,
yeah.
maybe on the forehead, the cheeks, wherever, this flashes an intense pulse of light into those brown spots and lightens them, which I think is, a lot of people don't realize there's something pretty simple that you can do to get rid of
an option. Now, for any of these services, do you come in for a consultation first and kind of say what this is you kind of tell?
Yeah. We typically do recommend a consultation. It's just easier for us to take a look at the patient and kind of decide what's the best treatment for them.
Okay.
So,
now, what about hydrofacials? So Desiree wants to know, what type of hydrofacials do you offer, and are they great for everybody?
hydrofacials are pretty good for everybody. Even people with sensitive skin can have a hydrofacial. We have 3 different levels. There's a basic level, there's the middle level that we do some booster treatments on, and then the 3rd level, which is the highest level, that one we just add in an LED light afterwards.
Okay.
So they are really good for everybody. It leaves your skin feeling nice and clean.
Yeah.
Pores are cleaned out.
Very refreshed.
Exfoliated. Yeah, it's nice.
And Mickey has a question. Do you take off excess upper lid eye skin? Is that something you offer?
We do not.
Okay.
That would be probably like a surgical procedure that we do not do that here, unfortunately.
Okay.
We do have things like BOTOX that can help, lift the brows, and that might be a nice alternative if you don't want to do surgery.
Yeah, and with the BOTOX again, is that something people typically come in and do a consultation with as well?
Some people do. Yeah, and oftentimes we can do a consultation and treatment the same day because it is a pretty quick procedure. So we can talk about it, and if they're interested, we can just do the treatment that day. Yeah.
Well, thank you so much. You can find out everything about the services they offer on their website, or even easier, you can give them a call and schedule an appointment, go through your needs. Everyone is so wonderful here. They'd be happy to help you. Again, you can go to their website. It's tcohio.com for more info. And thank you so much for sharing your time today with us.
Thank you.